Welcome to my presentation, The Ethical Dilemma Behind Paying for Healthcare, Right or Luxury. So the main question for today's presentation will be, should healthcare be considered a right or luxury? So this topic is significant because reducing healthcare costs and dealing with the pandemic rank highly in the list of national priorities for US adults as of 2021. So this issue is important given it is directly connected to US citizens, society, and the medical community. So I wanted to understand two aspects of the question, the philosophical aspect and the governmental aspect. So the first, in which I explored the value of healthcare and whether we have a moral duty to providing it to all human beings. I want to explore this because we all have felt that when you or your loved ones are battling some type of disease, everything else stops mattering and it becomes our biggest worry. So then the question now becomes, is it fair to exist in a world where billions of people don't get an equal opportunity to get care in this journey of life? Then the second, I focus on analyzing the healthcare system that exists around the world and which one complements my answer to the first question. So with this, I looked at what advantages and disadvantages each of them have in terms of three political aspects, which I will discuss in my presentation. So next, by establishing the notion of healthcare as a right, the right to pursue life and happiness are supported, which I will discuss in the next slide. Also, providing healthcare would coincide with religious, philosophical, and medical concepts of our moral duty to each other and to alleviate each other's suffering. Specifically, religions have historically built hospitals to help the needy. And then philosophically, Socrates and Confucius and many others believe in the golden rule philosophy, which states people act for the good of others because they would like to be treated in the same way. So if you wish that health be provided for yourself, wish it upon others. Lastly, in terms of physicians' Hippocratic oath, according to a 2004 study, medical personnel reported trouble in making decisions regarding life and death cases which require the purchase of expensive medical equipment for treatment. This forced an ethical dilemma between their right to help people and paying, and their right to help people being their Hippocratic oath. So, to focus on the first moral aspect. So how is healthcare related to life and happiness? So the founders, as we know, strongly favored a structure that protected the right to life, liberty, and happiness. So Helen Watt, an ethics researcher at Oxford, mentions that the connection between life and health are interchangeable by saying health can be seen as a functionality without some level of which a human being would not be alive, and thus as something very difficult to distinguish from the putatively separate good of life. Also, the preamble emphasizes the collective duty of the government to ensure that these basic rights of life, happiness are protected. So the founders promised to promote and secure the general welfare of or well-being of all Americans. So to deny that common human healthcare is itself an ethical dilemma that undermines one's legitimate right to life, well-being, which is clearly protected by America's founders. So going with this argument, when we discuss happiness, a 1-year increase in the duration of illness is associated with a 0.11 scale point decrease in happiness level. And to obtain self-actualization, Maslow, a well-known psychologist, has a hierarchy of needs, which indicate the importance of fulfilling safety measures like ensuring healthcare, and then physiological functions like nutrition and homeostasis to finally reach your full potential and happiness. So endorsing healthcare as a human right are supported by the founders and Maslow due to its relation to life and happiness. So overall, a healthcare system where no one is left behind is one that is worthy of the country's highest moral principles as supported by religions, Maslow, the founders, doctors, as well as philosophers like Confucius. So that healthcare system should be prioritized. So my answer to the first question, if we do have a moral duty to providing healthcare, is yes. And that system that coincides with those moral theories is universal healthcare coverage system, where every individual is provided some type of health coverage regardless of financial standing. So this can be accomplished under a public, private health insurance system or a combination of both. But who pays will not be talked about in this presentation. Instead, my focus will be why universal coverage is now essential in a political sense. So to start my political analysis, the US spends 17% of GDP on healthcare, nearly twice as much as the average OECD country. Still, the state of healthcare in the US is morally unacceptable in that millions are left uninsured every year. So we can also see that the majority of the world has universal coverage, but the US doesn't, as you could see in the picture on the left. So why should it be provided by the government in a political sense? So the three aspects that will be talked about are equality of opportunity. So a universal coverage system would promote equality of opportunity because it would equalize the opportunity between different economic and ethnic groups. So this would narrow down the health wealth gap and increase life expectancy for every group. Second is promoting individual choice. So by promoting individual choice, universal healthcare system actually would enhance the individual's consumer power. And lastly, I will talk about regulating corruption. And by regulating fraud, the universal healthcare system would actually regulate the fraud committed by both patients and providers, which I will talk about in the next slides. So the right to healthcare can be influenced depending on a country's respective decision to follow a universal system like Canada, or a more private system with no universal healthcare like the US implements. So I want to begin by saying opponents of universal healthcare argue that free healthcare restricts the free market due to having such intensive governmental regulation, which in their opinion restricts individual choice in their providers. However, the system that the US has, where the rich and poor struggle to obtain funds needed to get healthcare, produces more dilemmas around personal choice. For example, Americans fail to provide personal income and care options due to their healthcare system. So due to the constant shifts of healthcare plans, which are mostly employee-driven, and high medical expenses, which are 6 times higher for private systems than for public systems, and also associated medical-related bankruptcy, which are actually stated to be half of the reason half the people in the US file for bankruptcy. So in order to protect the right of choice in income and care, universal coverage ensures better care for all, while allowing the individual to spend their income more freely. So this is shown in Thailand, where in 5 years, their universal healthcare system reduced level of out-of-pocket expenditure and protective a cumulative of 292,000 households from health-related impoverishment between 2004 and 2009. This increase in financial protection also led to a rise in the use of essential health services. So a universal public system would expand personal control and introduce more consumer power to citizens acquiring healthcare and societal needs. Next, US healthcare system has aspects that actually strengthen racial and economic inequalities among American communities. So healthcare equalities are restricted by systematic differences in access and care between diverse economic and ethnic groups. So first, as we could see, that life expectancy is increasing for African Americans and the poor at a much lower rate than for wealthy whites. And then also, depending on a resident's race and ethnicity, as much as 30 years between the richest and poorest US countries in terms of life expectancy. So the same article also acknowledges that there are serious implications Americans face in equalizing their opportunities to survive. So America's poor live in poor housing, degraded environments, and have higher rates of suicide, drug overdose, accidents, and smoking. So patients in these areas also have very high medical expenses and lack adequate hospitals. So any health care reform needs to take these inequalities into account when creating a healthcare system that can serve all Americans. So among many countries With universal coverage, Canada has proved to provide adequate healthcare and access for its citizens. This US neighbor sets a really good example of achieving healthcare as a natural right. So Canada, due to their universal healthcare system, reported lower infant mortality, higher life expectancy between men and women, poor and rich, and lower suicide rates than the US. Additionally, by ensuring universal coverage in the US, we could actually promote over 650,000 people to control their diseases, such as diabetes, high blood cholesterol, blood pressure, and blood cholesterol. Also, since the universal coverage system brings about more beneficial changes to societal health and the notion of equality of opportunity, the US should desperately need to adapt this type of system. Next, I want to show on these two pictures that other European countries with universal coverage have a better management of diseases like cancer, diabetes, obesity. And then the picture on the right shows the variation of life expectancy in counties in Louisiana, showing how there's an inequality of access within the US. Lastly, I will talk about corruption. So in societies where universal healthcare is compromised, people can turn into illegal methods of finding relief. So the lack of universal healthcare among families in China resulted in excessive medical identity theft, specifically by those who lack health coverage. So we could see that the lack of care and access to healthcare has turned patients into criminals. And this ethical dilemma can be solved by striving for a society where individuals are not driven into theft to obtain care. So how does universal healthcare actually fix this? So an increase in the number of treatment facilities actually causes a reduction in both violent and financially motivated crime. So this prompts more people to stop falsifying identities in order to receive medical care, so therefore reducing the overall crime rate. So a universal healthcare system, in terms of the patient's ability to get care, is less prone to them having to go to corruption and fraudulent activities as a result of an increased opportunity for them. Next, in terms of the fraud, theft committed by providers, the well-being of patients is very much jeopardized by these actions. So the most common forms of medical corruption in this sense are counterfeit supplies, informal payments, fraud, and theft, as well as call-outs. So counter theft malaria medicines actually lead to 450,000 preventable deaths every year. Also, Pakistan, which has no universal healthcare system, has seen that their healthcare workers' greatest source of income came from the illegitimate resale of pharmaceuticals, mainly by falsifying legitimate insurance information in order to maximize their profit. Also, in the US, which also does not have a universal healthcare system, 5 to 10% of their public health spending are lost to overbilling by providers, which is another form of fraud. So in contrast, a universal healthcare system would rely on transparency, oversight, and accountability, aka TOA, and hence could regulate corruption. For example, Argentina, which has universal healthcare, hospitals are required to have regulated profit margins. With this type of transparency, pricing of medical supplies at hospitals in Argentina resulted in 50% decline in price variation across hospitals. So lastly, due to the universal healthcare system's role in promoting all these political and moral values that are crucial to a functioning country, I believe it should be endorsed and seen as a governmental moral obligation. Thank you so much for your time.